guys, welcome to the lesson about cerebral angiography. A cerebral angiography is a procedure where the radiologist or doctor inserts a catheter into the artery, usually the leg, and then they thread that catheter up to the vessels supplying the brain. They do this with a guiding X-ray, and iodine contrast is injected into the catheter. And the X-ray is going to show the blood flow in the brain using radiation to bounce off of the tissues. So the purpose of this procedure is to view and diagnose the brain disease or aneurysms. So this picture here shows a picture from a test showing an aneurysm right here. Let's explore what to do before the procedure. If the patient is on anticoagulants, ask the doctor if they want to continue them or if they want them held, and for how long. The patient's going to be NPO. This means no food or drink, and it's usually for about 6 to 8 hours before the procedure, probably the day of. Ask the patient if they have any allergies to any contrast dye and what type. Explain the procedure and have the patient sign the consent form. This consent can be done at the bedside before the procedure. That way the doctor can explain any risks to the patient. During the procedure, the nurse is going to clean and shave the area on the upper leg and groin area. The patient's going to receive a sedative through the IV to help them to relax during the test. They probably won't really remember anything. It's sometimes necessary to use general anesthesia on the patient, especially if they have a really hard time getting them to relax for the procedure. The doctor will place and thread the catheter into the artery through the leg. And they're going to thread it up to the vessel supplying the brain, where they're going to inject that contrast dye. And then they're going to use the X-ray to view it. So you're going to monitor those vital signs during the procedure for any variations. After the procedure, the doctor is going to remove that catheter. You're going to need to apply pressure for about 10 to 15 minutes to that spot. A closing device might be used. Keep that patient flat for 2 hours to avoid any bleeding. And then the patient's going to have to keep their legs straight for at least 6 hours after to prevent bleeding as well. You're going to monitor this patient's vital signs, and you're going to assess for bleeding in that spot in their leg. Next, we're going to talk about patient education. Let the patient know when they're able to restart those anticoagulants. And also let them know, hey, you're going to be able to resume activity the next day. Call the doctor if any redness or pain occurs at that injection site. So the priority nursing concepts for the patient with cerebral angiography are intracranial regulation, safety, and patient education. All right, now let's review the key points. So a cerebral angiography is a procedure where a catheter is inserted into the leg artery and up to the brain vessels. Contrast is injected and an X-ray is used to view the cranial vessels for disease or aneurysms. So before the procedure, make sure consent is signed and stop any anticoagulants that the doctor would like to stop, and then make the patient NPO usually the day of. During the procedure, you're going to clean and shave the area on the groin, upper leg groin area. You might provide an IV sedative to the patient to help them relax, and then monitor their vital signs during the procedure. After the procedure's over, go ahead and hold pressure on that site. There might be a closing device that you're going to need to use for about 10 to 15 minutes. Monitor their vital signs and assess for any bleeding from that site. Keep them flat for 2 hours and keep that leg straight for 6 hours after. Let the patient know they can resume activity the next day, and just to monitor that injection site to make sure no redness occurs or warmth or pain. Okay, guys, that's it on cerebral angiography. Now go out and be your best self today, and as always, happy nursing.